Hello, today I've been asked to speak about new robotic systems and telesurgery. Really look forward to getting your feedback on kind of the new landscape in robotic surgery as we see a lot of things are changing. Today's lecture will really focus on various new things that are happening in the robotic surgery forum. Definitely new platforms, things are already out there, robotic platforms that are in the making, and also the new frontier of telesurgery. In the past and still currently, we've seen the Da Vinci system really be the dominant force on the market. I've now done over 18,500 robotic prostatectomies and have used each of these systems, and each one has been a little more advanced than the last. And I would say that's the same for the Da Vinci 5. We have two Da Vinci 5 systems that we've done over 200 cases with now, and it is a better version of the XI, more processing power. The ergonomics are better, where you can sit more straight up and your head is not facing down. And so I think there are things that are improved by the Da Vinci 5. The ergonomics, the imaging, it's a smoother system, and you have a whole bunch of data analytic processing power. What we haven't seen at this point is kind of the use of that processing power. We don't have AR, VR, or AI feedback at this time, but I would assume that that's kind of the next step for this machine, is to improve the applications over time. But still, the system is very similar forearm system. What's interesting is there's a lot of new systems coming out on the market, especially from Asia, Europe as well. These are some of the systems that are out there that I'm aware of and have seen. But I think this is very exciting as we see diversity in the market starting to happen. Europe, US, Latin America also is making robotic systems. They're very varied and different depending upon the country. But once again, you see there's a very large influx of new robotic systems that will be available to the market, and hopefully that will decrease the cost of robotic surgery. CMR was one of the first competitors with Intuitive. It's a platform from the UK that has 3 arms and has over 100 working systems throughout the world, and over 23,000 cases have been performed at this time. Medtronic have also released their modular system. It's definitely throughout Europe and Latin America. We're seeing that there is a rise in the use of this system, and I believe that it's good for the market that there is diversity in other large companies coming to the market, potentially with lower cost, but it's not here yet in the United States. Distal Motion is another company from Switzerland and also has a US branch. They have CE mark and recently have FDA approval as well. And it's kind of a hybrid robotic system, smaller instrumentation, and it's available as an assistant to surgeons at the bedside doing laparoscopy, and also can be used as a primary robotic system. I think this is a very interesting system that will grow over time. Moon Surgical is a French-American team, and as you can see here, it's another one of these hybrid systems that is an assistant to a laparoscopic surgeon, and recently received CE mark and FDA approval, and we're starting to see these hybrid systems come on the market. Yet another hybrid system, but different, based upon the use of magnetics, coming out of Chile. As you can see, the surgeon is at the bedside and he's being assisted by a robotic system that is driven magnetically. MedBot from Tumai is probably one of the more dominant systems in China. I think it has the largest deployment of robots in China, and is definitely growing. Microport is the parent company, which is one of the largest medical device companies in China, and MedBot is a subsidiary that has Tumai. The Tumai robot is a 4-arm system. It's available throughout China, but has also started to go into Africa and is targeting Europe and Latin America currently. I think it's a good system. We've used it frequently, and we currently have one in our training center in Orlando. Karina is another system. You can see it's a modular system, and we did part of these clinical trials. It's not yet commercially available, but it's one of the other Chinese systems that is quite diverse in its use. So all of these systems definitely have the potential to revolutionize how we do robotic surgery. As you can see, they're very varied. They have different applications. And I think the addition of AI, VR, AR will all start to come into these systems and will provide an advantage to the ones that have it. Telesurgery is another thing that is going to be important, in which systems are able to be connected telesurgically. I think that is an important feature that we'll start to talk about now. Why telesurgery? Obviously, there's huge implications of being able to operate remotely, surgical training, education, emergency situations, and obviously the humanitarian aspect of telesurgery and remote access is very, very important. In 2001, Jack Marisko did the famous Lindbergh operation. We're using French Telecom and underground transatlantic lines. And it was a remarkable case. But over 20 years after that, we really didn't go very far. And I think the reason was the technology really wasn't ready. And I think probably as a culture, we weren't ready for remote surgery. As you can see, it cost a lot and was not easy to do at that time. So why now? Well, I think the telecom revolution is very important. The ability to communicate more reliably and faster makes telesurgery more relevant. You know, you've gone from 4G to 5G and now 6G. In many countries have 5G, and that allows us to realize remote connectivity on a higher level. And so I think the telecom revolution is what will help telesurgery become a real reality in many countries. There's also a lot more of these robotic systems that we just discussed throughout the world. As we get more and more diversity, you would expect the cost to come down, and maybe that increases the chance of other countries that do not have robotic systems potentially getting them. As you can see, there's a lot of them. These are all currently available robotic systems. The ones in green and red are ones that do telesurgery, and I have used them and been able to do telesurgery with them. The ones with just red and blue have telesurgical capability, as they've said, but I have not used them. And so as you can see, there's a big shift in the market towards systems that are telesurgically capable. We can divide them into multiple different categories now. Obviously, we have also a whole different category of endoluminal and single access robots as well. These are the ones that I see that are coming in the near future onto the market. Some are already telesurgically capable, but you can see there's a quite diverse variety of robots out there. As we look at the issue of telesurgery, you know, having the technology alone doesn't really solve the problem. There are so many other issues that we have to deal with: cybersecurity, ethical, cultural, regulatory, and obviously physicians licensing and training. And all of these issues make telesurgery quite complicated, no matter where it is performed. These are all the different stakeholders that are part of the whole telesurgery collaborative community, as we call it. And all of these people have to really weigh in on telesurgery. The telesurgery collaborative community is a working group that we formed earlier this year. We had a large meeting in Orlando. It was really kind of the watershed moment, the Woodstock of telesurgery, as they've called it, where telesurgery became a reality for people globally. The humanitarian benefits, I think, for me, are the most interesting and the most driving factor for telesurgery. being able to expand care across borders to remote areas, potential cost reductions, and improved access to care. That is, I think, what telesurgery brings and has the largest humanitarian benefit. As we look globally, there's such a difference in healthcare expenditure between countries, and there's definitely an inequity of healthcare resources around the world. And our hope is that telesurgery starts to make some of these go away. If you look at certain parts of the world, the access to any surgical care, or definitely high-end surgical care, is extremely limited. And I think the implementation of telesurgery may have a chance to improve this. We also have a dearth of healthcare providers and access to healthcare workers. And there are many parts of the world that are definitely underserved in the amount of healthcare quality workers that they have. And once again, I think by allowing remote surgery, potentially we could improve this access as well. Even in the United States, there's definitely an inequity of access to high-end healthcare, and there are remote areas of the country that do not have the same access as more populated areas. So I think the humanitarian benefits of telesurgery are definitely significant. Humanitarian aspects I think, are the most important part of it. And as you can see, potentially training, education, life-saving surgery in underserved remote areas, terrestrial, extraterrestrial, and even subterranean applications will happen. Obviously space is one of these things that is being explored, but what happens if somebody has a medical issue that needs surgical intervention in space? And just recently, Virtual Incision sent one of their micro robots up into space and it started trying to control them remotely from the Earth. And I think these things will continue to improve. So is telesurgery a reality? I think so. I think we went and we spent time in India, Japan, and China. Asia really is the key right now for telesurgery. And we use various robotic systems and we operate in various parts of the country. I would be usually in Beijing or Shanghai, and my team would be distant wherever the patient was. And we would test the robotic surgery capabilities, and everything went very well. As you can see, it's quite complicated managing all these telecom signals, and that's why we need telecom experts as part of the team. But it is manageable, and the connectivity, whether it's Wi-Fi, 5G, cable, all seem to work for us over a certain distance. We were performing robotic radical prostatectomies. At one point, we used the Edge robot, with me being in Beijing and my assistant 2,700 kilometers away, and we were able to actually operate successfully with very minimal issues with surgical latency, less than 100 milliseconds, where my assistant really could not appreciate any difference from being next to me in the operating room at our home institution. Obviously, connectivity and managing latency is the key to telesurgery in terms of compatibility for surgery. And this is the scenario we had where we were able to look at the latency times and see all of the different aspects of the surgical team in real time. And so maximum connectivity and maximum visibility of all the different components of the surgical team for telesurgery. We were able to successfully operate at a distance with many different systems. This is just one of them where we actually did a live telesurgery to show globally the potential implications and options for telesurgery. We also used the Kangdo robot from Beijing, and it was very interesting. We did a teaching case where I was in Beijing, the patient was in Hainan with my surgical team, and the person being trained was actually in another city, Hunan. So triple console surgery where we connected 3 different systems, I think has huge educational importance, where potentially the trainee could stay at the home institution and be separate from the patient and also from the surgeon that is training. We also spent some time in Japan with Hinatori, and it was very interesting to see their telesurgical capability. It's a nice system that's being used throughout Japan, but as you can see, the Japanese Surgical Society is also starting to be a part of this whole telesurgery community and starting to test the platform as far as Singapore, 5,000 kilometers away. Lots of recent advances in the animal and the human model, various different specialties, including ophthalmology and cardiac and neuro, looking at telesurgical applications, obviously in telestroke and also in remote cardiac stenting. These are potentially life-saving applications. This was a very important case that we just saw from Edge Medical. Dr. Zhang Su was able to do a live case a few weeks ago at a distance of over 8,000 kilometers from Rome to Beijing. In India, they're also looking at telesurgery. The SSI Mantra system has been out for some time now and is starting to develop remote capabilities. And as you can see here, during one of the meetings, they started to demonstrate the remote capability of the surgical system. And recently, they've done various cases, starting with cholecystectomy, but they've been as advanced as doing a radical cystectomy remotely using the SSI Mantra. How far is too far? That's still to be known. We were lucky enough to get it to my MicroPort MedBot system in our lab in Orlando, and we decided to kind of test the extremes of connectivity. And we looked at the MicroPort system because of a significant experience in telesurgery. I believe they've done over 100 cases now, and they've had good success in multiple different specialties, as you can see, with urology being the primary. The reason we use this system is we were quite familiar with it, and we had it available in Orlando, and we were able to connect to Shanghai, about a 26,000 kilometer round trip for the signal, but a distance of 13,000 kilometers between the two cities. And we wanted to test the latency. And we were able to get pretty good. About 280 milliseconds was the best we were able to do. Acceptable to do an animal lab, which is being done here. This is the renal hilum, and remotely we're able to place clips and dissect the renal hilum and do partial nephrectomies in an animal model 13,000 kilometers away. The latency is still high, over 200 milliseconds, and it needs to be lower, but at such an extreme distance, we were able to demonstrate connectivity and applicability. And so it's very interesting to see the ToMai MedBot system being able to operate remotely. And I think this has huge implications for the humanitarian aspect of surgery. Also, recently we had a single port from Shirui from Beijing. And this is an interesting single port system that has great flexibility and good strength. And we were able to also use that in the lab and connect it remotely from Orlando to Shanghai, doing single port renal dissection at an animal 13,000 kilometers away. So as you can see, many of these systems are starting to be telesurgically capable, and I think it provides great optimism for the future. With that being said, back to all the challenges of telesurgery. So you can see the telecom, cybersecurity, the reliability, consistency, regulatory issues are all there. I don't think we have the answer yet, but that's why the telesurgery collaborative community was formed. The humanitarian benefits, I think, will drive this innovation. And I think robots that have telesurgery capability will have a competitive advantage, but there are a lot of issues that we need to deal with still. So the road ahead requires cooperation from all of these different stakeholders, and it requires caution as well. We definitely don't want to suggest that telesurgery is an easy plug and play. It's the opposite. It's actually quite difficult. It took us weeks to figure out the connectivity from Orlando to Shanghai that was reliable. And I think people looking at telesurgery should be very careful and have members of the entire stakeholder team that we've shown in order to do it safely. But telesurgery is a new frontier. I think all these new diverse robotic systems will help push that forward, but I think the humanitarian aspect is really the key. But we must first and foremost remember why we're doing this, and this is to take care of our patients, and we must do it in a safe, ethical, lawful, and cost-effective way. And I think this is what our challenge is over the next 5 to 10 years. So I really want to thank you for allowing me to share my thoughts, and hopefully I can see you soon, maybe at the Asian meeting for robotic surgery in Indonesia. Hopefully you will join us. It's a very exciting time for us in the whole robotic surgery realm, and I hope you will join us in 2025 for our Society of Robotic Surgery meeting. We just had it, and it was amazing to have 50 different robotic platforms present and have a great discussion. So please join us in July of next year. Thank you so much.